Do you have a personality disorder? This is a question that most of us have asked ourselves. Well, the answer is not that easy. You can't know for sure if you have a personality disorder unless you are diagnosed by a professional worker like a psychologist or a psychiatrist. But there are some signs that can help you identify it in yourself or in others. First, let's have a look at what a personality disorder is. A personality disorder is a mental health condition that involves long-lasting, disruptive patterns of thinking, behavior, mood, and relating to others. These patterns cause a person significant distress and could also impair their ability to function. Personality disorders can also cause distorted perceptions of reality, abnormal behaviors, and distress across various aspects of life, including work, relationships, and social functioning. There are 10 types of personality disorders, each with different characteristics and symptoms. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is the standard reference publication for recognized mental illnesses, organizes the 10 types of personality disorders into 3 main categories called clusters. Cluster A personality disorders are characterized by unusual and eccentric thinking or behavior. They include 3 types: paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Cluster B personality disorders are characterized by dramatic, overly emotional, or unpredictable thinking or behavior. People with these types of conditions display intense, unstable emotions and impulsive behaviors. They include 4 types: antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Cluster C personality disorders are characterized by anxious, fearful thinking or behavior. People with these types of conditions display severe anxiety and fear. They include avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. Well, a bonus piece of information for those who are still with us. It is possible for people to have traits or symptoms of more than one personality disorder at the same time while not meeting the criteria for any single one of them. A person can be diagnosed with more than just one personality disorder. Research has shown that there is a tendency for personality disorders within the same cluster to co-occur.